the total cost in this budget to the state for Medicaid this year, do we have those numbers?
Yes, the total Medicaid expenditures are projected to total $72.5 billion.
And where does that come out in comparison to the executive's original proposal?
It's about $88 million above the governor's proposal, reflecting various Medicaid restorations.
One of the things there were, just in my brief review of it, there were quite a few changes that have been proposed within Medicaid in terms of intentionally, like omitting some of the MRT proposals. How do we get to the point, if we're omitting all those, which a lot of those were cost savings, how do we still get to basically being pretty close to what the governor proposed?
Well, first of all, we did find additional savings in some re-estimates of Medicaid, but there also were restorations that were agreed to, restorations from last year's, that were in last year's budget that were agreed to, some in the pharmacy, prescriber prevails restoration, for example. We restored spousal protections for community spouses to prevent impoverishment. We made many changes, many restorations in the transportation area. So when you start to add up some of those, we come up with $148 million in restorations. There's $30 million in support for safety net hospitals and $183 million in offsetting reductions. That's how we stay pretty close to where the governor was.
So you're confident that those numbers are good, and I know there is a global cap. Are we staying within that as well in these?
Yes, absolutely, within the global cap.
Certainly for county governments, Medicaid, the local cost to Medicaid is a major burden, even though we've, over the last number of years, taken some steps to freeze costs and to limit the costs at first and then to freeze it. But there are some proposals both in your side of the aisle and on our side of the aisle, which would actually have the state move to take away those costs. There have been some estimates somewhere between 45 and 50 cents of local county tax dollars going for that Medicaid cost. And so were there discussions about that? Is that something that at least was part of the conversation? I know it didn't make it here, but one that we ought to, we have a chance to make a difference, hopefully, going forward.
As you and others may recall, in our when this issue came up as we were debating our one house assembly proposal, and we discussed how because of the the takeover of limiting the cost to counties of just 3% year over year, and then several years ago taking all of the costs above that level on behalf of the state, assuming all of those costs. We've saved the localities approximately $3 billion cumulatively. To enact a proposal that would fully take over the county's share, locality's share of Medicaid would be over $7 billion, and it just isn't despite whatever desires exist, there just aren't the finances to be able to do that.
my hope would be as we go forward that we might have, you know, the phase-in of that doesn't make it quite as burdensome to the state initially, but something where we get to that point. But thank you very much,
Thank you.
Chairwoman.
Thank you.